The Baltimore City Council Health, Environment, and Technology Committee is now called to order. I am Councilwoman Danielle McCray. I represent the 2nd District. I'm also chair of the committee. In attendance, we have, as for one of the members of the committee, is Councilman John Bullock, representing the 9th District.
Madam Chair.
Thank you. And we also have our Vice President, who is joining us, Sharon Green Middleton, representing the 6th District. From the Mayor's Office, we do have Sophia Gabrin-Hewitt with us today. And also in attendance, we have Matthew Peters, staff to the committee. Before we get started, please take a moment to turn off or silence your cell phone. Also, if you have joined us in the council chamber and you would like to testify, there are sign-in sheets in the back of the room. Please sign in and check the box to indicate that you wish to testify. Today, the committee is reconvening Resolution 22-0110R, Investigative Hearing, Baltimore City as an Abortion Rights Protection Jurisdiction. For the purpose of requesting that the city solicitor and representatives from the Baltimore City Health Department appear before the City Council to evaluate if Baltimore City is prepared for an influx of patients seeking to terminate a pregnancy, to identify current barriers to accessing abortion health care services, to identify disparities in the ability to access abortion health care, specifically for the lesbian, gay, bisexual, transgender, and queer community, and for marginalized racial and ethnic groups, to identify safety concerns abortion healthcare providers have in the present political environment and explore how to address these concerns, and to specify how the recently passed State Abortion Care Access Act will affect abortion healthcare services in Baltimore City. The committee held a hearing on this resolution on July 27, 2022, and is reconvening today for the Health Department to provide additional information and an update. After the Health Department's presentation, there will be an opportunity for council members to ask questions, and then we're going to move on to public testimony. I want to begin by thanking Vice President Middleton for bringing forth this crucial piece of legislation. Since our last hearing, we have witnessed the inaction of trigger bans and changing status of abortion access in our country. Cities that still have abortion service access have taken diverse measures to uphold the right for all, regardless of residency. Our Baltimore City Health Department is the oldest continuously operating health department in the United States. I do feel that it is our duty to continue to be national leaders in the creation of logistical and operational plans to address the needs of pregnant and parenting individuals who will migrate in search of services and safety, to protect the confidentiality of those individuals and providers, and educate our residents and external partners on the protections, plans, and resources our city has in place during this historical time. I'm going to move to the bill sponsor for their remarks, and that's just going to be before we start the presentation. I would like to recognize the sponsor of this bill, which is Vice President Middleton.
Thank you, Chair McCray, and thank you, Commissioner, for taking time in your schedule for us to basically start over again from this committee. First, I just want to say that way back in June, Councilwoman Porter and Cohen introduced an immediate adoption of a bill based on what we're about to talk about today, and it was supported unanimously by the council. And our mayor also provided funding to nonprofit organizations for this particular subject as well. And so this bill came about because we felt that we needed a deeper preparedness conversation about something that is taking place really nationally around the country. And in fact, it's one of the most bitterly contested civil rights issues that I thought personally we would never have conversations like this again, especially for with abortions. We as council members, elected officials, we're responsible for protecting and promoting the health of individuals and communities across a wide range of issues. And this is, again, a very important issue. And when the mayor distributed or decided to give funding to help with these nonprofits, it was also something that was approved by the council. And it's part of our jobs to make sure that certain things are in place and taken care of with basically with every subject, with every agency. That's why we also have budget hearings. This particular topic is about the access to healthcare services that affect not just the person that has to make an important decision like this, but it affects everyone. It affects families. We want to help and represent the people that live here that have to make decisions, as well as us being a welcoming city. And we're going to have an influx of people coming in. We just want to make sure that our health department has things in place. We understand, and I think this issue came up at the last hearing, that it was stated that the health department does not perform abortions. I think we all know that. We know that there are organizations out there that do this work. That's not the job of your agency or any agency that's basically under the mayor and city council. We have particular duties that we must perform. I can't say it enough. We don't want to see things happen like back alley abortions being performed. Women are already in crisis situations, and it really has come out through the pandemic. And for me, this is an emergency. This is something that we as a council need to know what the health department, what your plans are, what you're doing. And I'm hoping that this presentation will help clarify something that I thought was explained very simply in the description of the bill. We want to stay on the forefront of this, and we want to make sure that the health department has a plan, a start plan to, for simple things like is there going to be training for 311 if someone calls for help in making a decision? We are a city that is noted for a number of colleges, and students, have to make decisions or get in trouble. So we just want to know that there is help out there to help people that call in for us. And again, I hope your presentation will help and clear up some of the questions that we might have. Thank you.
Thank you, Madam Vice President. We have also been joined by committee members, Councilman Torrance and also Councilman Conway. At this time, we're going to hear from our Health Commissioner, and she will be providing our presentation.
Great. Thank you, Chair McCray. Good morning, everyone. My name is Dr. Letitia Jarasa, and I'm the Health Commissioner for Baltimore City. I do want to thank Chair McCray, Vice President Middleton, as well as Council Members Bullock, Torrance, and Conway for this opportunity to talk about reproductive rights and really to discuss our role as the local health department in supporting those rights in Baltimore City residents. Wonderful. So I will start by reviewing some high-level data and demographics of the population here in the city that's most impacted. I will then review the health department's current role in supporting residents as well as providers. I'll spend some time discussing our preparation and next steps in the work. And I also want to just take a moment and acknowledge our partners who we've invited here today, Planned Parenthood of Maryland and the Baltimore Abortion Fund, who will be providing expert testimony. So beginning with our demographics, approximately 135,000 women of childbearing age live here in Baltimore City, and when we refer to childbearing age, we're referring to women between the ages of 15 and 44. The racial makeup of this group is very similar to the city's racial composition, with about 60% being Black, 30% rather being white, 6% being Hispanic, and 4% being listed as other. When we talk about abortion prevalence, in the US, about 13.5 abortions occur per 1,000 women. In Maryland, that number is estimated to be about 25 abortions per 1,000 women. And in Baltimore City, when we think of total numbers, not necessarily a rate, but total numbers, it's estimated that anywhere between 975 and 2,388 pregnancies end in abortion. When we look at the state and look at the city in terms of who provides abortion services, Maryland has 44 freestanding abortion clinics statewide. 2 of those are in the city and 3 are in neighboring counties. So briefly discussing our current role, when we think about abortion services, I think it's also very critical to think about them in the context of broader reproductive health services. So as a Title X provider, we provide many reproductive health services to women across the city and largely serve as that safety net provider for women who might not otherwise have access to such services. So this includes multiple forms of birth control such as IUDs, Nexplanon, and oral contraceptive pills. We also provide emergency contraception. We're able to do pregnancy tests. We can refer for comprehensive obstetrics care. We provide breast exams and pap smears, as well as STI screening and treatment, HIV testing and counseling. We also screen mothers who come in or potential mothers who come in for substance use and mental health disorders, and we can refer to counseling, as well as provide more health education and outreach. And we also make referrals to abortion providers across the city. So we provide these services in our East Side and West Side clinics. We also support other clinics across the city who do Title X work. This includes our school health program, our needle exchange program, Baltimore Medical System, a federally qualified health center here in the city, Johns Hopkins Harriet Lane Clinic, which is their teen and adolescent clinic, the University of Maryland Adolescent and Young Adult Center, and the Hopkins Rails School-Based Health Center. So as we think about planning post-Roe, we know that it's going to be necessary, as has been stated, to support both our residents and our providers so that they feel protected around women's health issues, specifically women of childbearing age. So since the overturning of Roe, we have met with the state and held several individual partner meetings with abortion providers to discuss potential challenges. We've also developed a preliminary profile of service location and utilization and a one-pager outlining the current situation. We've updated the resources on our website, and we also refreshed our 5-year youth sexual health strategy to support reproductive justice. We'll continue to monitor the Abortion Care Access Act and training for new service providers in the city. So thinking about next steps, again, in the context of this comprehensive approach to reproductive care, I did want to highlight a few tangible action items. So we want to ensure, certainly as a Title X provider, that we are providing service optimally. So guaranteeing easy and rapid access, for instance, to birth control or to education around birth control. We restarted our Youth Sexual Health Monthly Coalition, or we're planning to restart that coalition here in the fall with this refresh strategy to incorporate reproductive justice. We'll be coordinating with the state on abortion clinical care training programs. We will continue to ensure providers and residents and agencies understand Maryland abortion laws through education and outreach. And alongside our partners, we'll continue to clarify abortion care service utilization and projection of the potential need for services here in Baltimore City for residents as well as those who might come in from out of state. We'll continue to focus again on that larger picture of maternal and child health, specifically placing emphasis as well on prevention, and I'll talk a little bit about that in the next slide. But we certainly want to ensure that abortion care services remain a part of the spectrum of all reproductive care services as we think about reproductive health rights. So I do want to touch again on how we're already beginning to fill those gaps in reproductive health services. Again, much of the work that we do on the ground focuses on prevention measures for unwanted pregnancies. We're fortunate to have providers such as Planned Parenthood, but we also want to optimize our current reproductive health services. As previously mentioned, we'll be implementing the youth sexual health strategy established within a reproductive justice framework this fall. And we recognize really the very critical need for equitable access to family planning services. So that's why we work with partners like our federally qualified health centers. To date, we've trained over 100 city providers at hospitals, school-based health centers, and clinics in family planning and counseling methods. In collaboration with city schools, we'll continue to expand and implement evidence-informed sexual health education for students. We were previously grant funded to do this work and have already provided training to some high schools as well as middle schools. We'll also seek additional funding for our Be More for Healthy Babies and Youth Sexual Health program. Both programs support optimal maternal health in the preconception and postpartum periods. Since those programs have been implemented, we've seen a 47% reduction in teen births since the launch in 2010, from 2010 to 2020. We've also seen a 48% decline in racial disparities between non-Hispanic white and non-Hispanic black teen birth rates. In closing, I did want to highlight just a few resources for residents seeking support for abortion services. Again, we want to make sure that our residents are aware of what is available. As I mentioned earlier, we do have 2 partners from this list who are here to present expert testimony later on. So I do want to frame their testimony a bit because I think this speaks to much of the nature of the bill. So our partners will be discussing, what we're currently experiencing in terms of an influx of patients, how are current residents being supported from an equitable lens, what safety measures are in place for current residents seeking abortions and possibly out-of-state individuals seeking abortions, and what does long-term planning and partnership look like as we consider neighboring states may be revoking abortion rights. We'll also kind of close to talk about what additional support or advocacy may be needed from city leadership. So again, I do thank you all for this opportunity. I'm happy to answer any questions, and then I know we anticipate hearing from our experts here today.
Thank you, Commissioner Girazza. I'm going to go ahead and start with the committee questions, and then we'll be moving on to Madam Vice President. My first question, and this was also asked within the first hearing, knowing that there will be an influx of patients coming to our state, coming to our city, what does collaboration look like with other city agencies, knowing that these pregnant and parenting individuals, they will need additional resources when they get here? So what does collaboration look like so far with other city agencies?
Yeah, so I think I mentioned the one pager that we've updated. I think I'm happy to begin with meeting with those in the Health and Human Services cluster. We did start meeting regularly, and so starting with them, since a lot of times that might be who would be called upon to provide support, I can review that one pager with them and begin to ask any questions or answer any questions that they might have about this potential influx of people coming in to seek services. I think, and we'll hear from our experts a little later, I think we're still also just trying to evaluate what that influx might be. Obviously, again, we may have some neighboring states, maybe West Virginia, who potentially revoke or have already, revoked some rights. And so trying to gauge and estimate what that population might look like, and if they will come to the city to seek services. We know that they certainly could, but we also know that there are certainly clinics statewide. I think that's also where it's important for us to kind of partner with the state who may have a better grasp on what's coming in. But I'm happy, to meet with, again, starting with that Health and Human Services cluster to make sure they understand what services we provide and can answer any questions that they have first, and then can certainly expand that to additional agencies.
And I would I agree. I would definitely like to see a proactive approach in engaging the other city neighbors, excuse me, not city neighbors, city agencies that we know will play a role when it comes to resources. The one-pager that you're speaking of, is that accessible on the website right now?
I'm going to defer to, we have our Assistant Commissioner, Rebecca Deneen, here today. I don't know that we've posted it yet, but I'll let her answer.
No, but we can post it on the website. The resources are posted on the website, but we certainly can post it on the website. The one pager wasn't intended to be a public website-facing document. It was intended to be a partnership-oriented internal collaboration document.
Okay.
We would certainly, if you like that to be posted, edit it and make sure that it's appropriate for public-facing consumption.
If the health department, if it's not, I assumed it was, unfortunately assumed that it was a public-facing document. But what I would request is if you guys could furnish it to the committee, at least. Also within the resources, I know that you said that you updated the pages on the city's website. If you could also provide that information or where someone would be able to go to access that information so we can at least put it in the chat or just say it on this hearing as well before the hearing concludes. And thank you. I'm going to move on to Madam Vice President Middleton at this time.
Thank you. Just to piggyback on the website, do you estimate when the website was updated?
We're going to defer to Assistant Commissioner.
The chief of staff was updating it this week.
Yep.
I don't have the exact date, but I asked her right now, and I will get back to you.
Thank you.
And I'm sorry, guys. Ms. Deneen, if you could move to a microphone and I apologize to the public, if you can also just introduce yourself as well. And just state that you're with the health department. Thank you.
Hi, my name is Rebecca Deneen. I'm the Assistant Commissioner for Maternal and Child Health at the Baltimore City Health Department.
Rebecca.
Oh,
You can
is that
pick
not
that up.
on? I'm sorry.
Yeah.
This is, where do I turn it on? Hello? Is that better?
Yes.
Sorry about that. Hi, my name is Rebecca Deneen, and I'm the Assistant Commissioner for Maternal and Child Health at the Baltimore City Health Department.
Thank you. Thank you for supplying some and getting some resources to us. And I see there's basically addresses. Are there, I'm really interested in phone numbers as well, because
Okay.
we do, you know, we are still a city that, where people are still not, they can't get emails, don't have access. Is there going to be, or are there plans to have some kind of hotline connected, or to a hotline that's already set up where someone can come through a hotline phone number I'm talking about? Phone numbers are very important to the people of the city for access.
We can definitely try to find numbers for all of the entities listed and however we've updated the website. Right now, individuals would probably have to call our general line at the health department, and then we can redirect them appropriately.
Okay. And you had mentioned that there was going to be outreach in our public school system. Do you have are there particular courses that they're going to include this in the high schools, or how are they going to give information out in middle school? Has there been conversation?
Yeah, so maybe I'll start and then I'll let the Assistant Commissioner chime in. So we were grant funded to provide training around evidence-informed sexual health for our high schools and middle schools. So we've already done much of that training. We also have the You Choose program, which is another grant which focuses again on reproductive health, and that is implemented throughout all of our school-based health centers. So we're already doing some level of that work. As far as a specific course, it really is, I think, training of those individuals that are already in school, but I'll defer to the Assistant Commissioner if there's more.
And the program you said was called You Choose?
You Choose.
Okay.
So back in 2010, the city schools didn't have an evidence-based sexual and reproductive health curriculum. And so Ms. Kathy Watson, who's our Director of Adolescent Health and Adolescent and Reproductive Health, and I worked with city schools closely to write a grant to the Office of Adolescent Health. And we received a 5-year grant to implement evidence-based sexual health in city schools. So our goal was 10,000 students a year, and we reached that each year starting in year 2. The curriculum is for high schools, so we've reached all of the city high schools with it, and that has been training of teachers and implementing the curriculum into the city school curriculum. The middle schools, we've reached 50% of them. We wrote a follow-on grant. That grant is being used as well to continue this work. It is work that is integrated into city school curriculum. It needs a lot more monitoring, a lot more financial support, but I will say that there is a very strong relationship now between the city health department and city schools. We're also working on the COVID response together and many other things. So for the example of abortion care services and the extent to which there's an appropriate need to communicate with city schools around this topic about resources, we certainly have all of the connections we need to do that. What we wanted to do is make sure that we have a real understanding of what the projected need will be. And in talking to our abortion care partners, it appears that there's some challenges with projecting what that need is going to look like. And so we're working with the Guttmacher Institute. The Maryland State Department of Health is reluctant to provide projections, so we're working closely with Guttmacher and with our partners at Planned Parenthood to try to sort out what that projected need and what that will look like in the landscape of services. But for the prevention side, You Choose Know What You Want was a campaign that under that Office of Adolescent Health and through a number of private foundation funders, we were able to, under the umbrella of Be More for Healthy Babies, introduce a campaign with MICA, the Maryland Institute and College of Arts, worked with our teens to develop a social marketing campaign called You Choose Know What You Want. And that was used as a way to drive traffic to our website for prevention services, so for reproductive health care services. So we mapped out all the reproductive health care services, of which I will tell you in 2010 there were very few federally qualified health centers or anyone else offering any kind of contraceptive method that was long-acting in those centers. So we spent our time with that campaign and with funding from the private sector to reinforce and introduce a number of trainings to healthcare providers so that we could have long-acting methods move from having only in one birthing hospital to all the birthing hospitals, in 2 federally qualified health centers to 80% of the federally qualified health centers. And all of that work led to this reduction in teen birth. So Know What You Want, You Choose Know What You Want is a teen-driven, teen-voiced campaign that was used for the major purpose of preventing pregnancy and supporting children to make better decisions about their sexual health. And that was a close partnership with city schools, who their role in it was to implement the sexual health curriculum.
Thank you for that. I'll stop there, Madam Chair.
Committee members, do you guys have any questions? Okay, Councilman Conway.
Thank you, Madam Chair. Just one question regarding considerations for transportation for folks coming out of state. I know we don't control our clinics, we partner with them, and I know we don't control certainly transportation, but have we thought about it all by way of communication, our website, otherwise, what resources and how we can kind of ease information into the hands of folks who may be of need about transportation to and from these places?
So I don't know that we've spoken specifically to transportation. Certainly some of the funds that we've listed, I think provide funding for transport for individuals who need it, but I don't know that we've specifically called that out. We can certainly, make that addition so that people are aware that there are potential funds available for transportation in state.
Awesome. And I think also to further kind of focus on that point, on the website, for folks who may not be familiar with Baltimore City, may be coming from out of town, they may not be familiar with the roads and so on and so forth, as best as possible making that information clear so that, if we have to put directions on the website or whatever the case may be, of course, certainly folks can Google it, but some folks may not have some of that sophistication, and we want to make it as simple as possible. So just want to provide that as a suggestion as well.
Yep, thank you for that suggestion.
Thank you.
Okay, so I just have I have a few additional questions. The first one is, I know that we have some stakeholders and providers who are going to be testifying later, but I do want to hear from our health department about what the collaboration looks like with our local abortion providers and organizations. I know that you did briefly discuss some stakeholder meetings that you guys are initiating, some future steps, but what else, what do we know has been done just to establish a coordinated response, make sure that we understand the needs for these groups, what the city can do to support in their efforts, and just how are we educating, or is there a plan in place, or are you working towards that plan, that full plan to educate residents and just external stakeholders who need the information? I just want you to elaborate on what the collaboration looks like.
Sure. I'll start, and certainly Assistant Commissioner can chime in. I think, to date, the meetings have been relatively informal and maybe more informational on both sides. So again, as was asked by this committee, trying to understand, are there predictions on what the influx will look like, and beginning to ask what supports those groups think that they might need from us. Obviously, there's education and outreach, but are there additional supports and resources that the health department can bring to bear to those organizations? So informal meetings to date. Certainly, we are talking kind of long-term with the state health department around bringing those groups together for more service training. There could be an opportunity for a convening. I will, be honest and say that, resources dedicated solely to this, we don't have those resources at this point, and so we'd be seeking additional funding to support ongoing regular convening. So, we talked about Be More for Healthy Babies and how, we have grant funds and support to do those large convenings and host those groups. We don't at this time have funding set aside to do that. And so again, a lot of what we're doing is trying to partner with the state as a lead to meet with those groups and begin to gather that information. If additional resources become available, I think we could have this, very large convening and that's more formal than what we have now, but a lot of the work has been, relatively informal to begin with.
Thank you. Some other cities that have abortion access, they've actually begun working with cities that have lost access in order to ensure that there is infrastructure in place to get individuals the reproductive health care that they do deserve. I want to know, have you been communicating with other cities? Has Baltimore been in conversation with other municipalities that have limited banned access to abortion to bridge the gap and just to establish a dialogue proactively?
I have. So I've had a lot of conversations with other health departments that are big cities. So more kind of our big cities. I'm a part of a Big Cities Health Coalition as one of the 35 members, and so we've had a lot of discussion. This group meets regularly around those cities, depending on where they are, that may have lost access, and again, how we as a network can support one another and making sure that there is access available. So this group, again, has been kind of meeting separately to talk about that. Nothing formal at this point, but certainly have had those initial meetings to see what resources, again, we can bring to bear as a local health department.
I'm glad that the conversations are being had. We're going to go back to Madam Vice President.
Just to add, are you looking at also resources that basically funding for the actual person that makes a decision to get an abortion? That, a lot of times people go to drastic measures because they don't have the money. Is there going to be conversation, or is there already something in place? I'm sure some of the others that are going to testify might have some answers to that, but does the City Health Department have, are you considering to help in that way?
We're not at this time, I think, because we do have great partners in that space, like the Baltimore Abortion Fund, who do that work. And so I think we certainly have the obligation to make sure that residents are aware that the funds exist, but we're not specifically seeking funds for that purpose.
And I think I had mentioned too earlier about consideration of training a 311 operator if someone comes in, and wants help. Is there going to be a setup or some kind of training for them?
We can absolutely provide a script. I don't know that we've set up formal training yet, but we can certainly provide a script that can be shared with the 311 team so that they have it. We've certainly done it for COVID and other things, so we're happy to do that.
And you had, I think there was one slide where you had said there were 2 clinics. Two city clinics? What are the locations, just for the public's information? What are the 2 locations of those clinics?
Planned Parenthood is over on Howard Street, is it?
Yeah.
Howard Street.
Howard Street, for Planned Parenthood on Howard Street is one of them.
Okay.
And then,
And then the other one, Kathy, do you know the address of the other? Or-
Ms. Sundin, can you,
Oh.
Assistant Commissioner, can you speak into the mic, please?
Ms. Watson, do you know the location of the second abortion care clinic? Sorry. It's on the resource list, but I don't have it off the top of my head. The main resource that we refer folks to from our 1515 North Avenue site is to Planned Parenthood of Maryland on Howard Street.
And these are definitely LGBTQ friendly.
Yeah, and what we have is a map of all the LGBTQ-friendly clinics. They might not be offering abortion care services, but for our youth sexual health strategy, we've mapped out the clinics in the city, including Chase Brexton, and I have a whole list of them if you want to see them, that are LGBTQ-friendly, and that would obviously be a part of this referral network. And I would just want to say that we have an existing referral network with healthcare providers that we use that we've used for reproductive health services. There has not been, because Maryland has had support around abortion care, this has not been an issue for us that has come to the health department as a major area of concern until the Roe v. Wade. And so now is a time when we're looking at what is the projected incremental new need for abortion care services, and it's taking some time to get those projections out. But we have the partners already in place for which to create a provider network. And as Dr. Giraz has said, our youth sexual health strategy includes all those partners, and we're planning on convening in the months to come.
Thank you. And I just want to end by saying that, the council we are partners too. And if there are brochures, or we are always in our communities, community meetings, just different events. If there are ways that we can help as a council in individual areas, some of these 2 clinics are not, they're mostly downtown area. Mm-hmm. So council members that represent areas outside of that, there's ways that we can help and get information out as well, and just want to let you know that we're there to help in any way we can with this subject.
Great, thank you.
Dr. Shiraza, we found the clinic is Whole Women's Health on 7648 Bel Air Road.
Okay.
And then the other clinics are other addresses, but we're happy to share this list with the addresses and the telephone numbers. I just want to say we're cautious, and our partners can talk about this as well, of putting addresses on websites that people could then look up and immediately go and cause trouble. So part of the reticence to be too public is to try to use our networks in the most constructive way possible and not to be risking any bad effects on either the providers or the clients using services.
Definitely understood. I think that's it with my questioning.
Okay, I just have one last question. I just want to know what steps is our health department taking to stay abreast of inclusive language surrounding reproductive healthcare access in those impacted, specifically for our LGBTQ plus community.
So we've been partnering with London in the Mayor's Office of LGBTQ Affairs, who is helping with kind of a website review to ensure that the language is inclusive. We've certainly been working very closely with her around monkeypox, and we see this as another opportunity again to engage her in the services we provide. Additionally, we want to make sure that individuals who are non-English speaking also understand how to access our services. So our Eastside Clinic, for instance, sees a lot of Latinx community members, and that group, I think, is very well versed in supporting that population and the immigrant population as well.
Okay. Just want to double check, committee members, did you have any additional questions? Okay. So we are going to move on to public testimony at this time. Members of the public, you will have 3 minutes each to provide your testimony. As a reminder, if you're in the council chamber and you would like to testify, please sign in and check the appropriate box on the sign-in sheet at the back of the room. If you have joined us through WebEx and you would like to testify on this resolution, just please use the raise hand function to let us know. And first we have Lynn McCann, and I'm just asking that you just introduce yourself with your first and last name and the organization, if you're with an organization as well.
Good morning, everyone. Thank you for having me. My name is Lynn McCann. I'm testifying on behalf of the Baltimore Abortion Fund. We are a community-based nonprofit that provides financial and logistical support to help people access abortion care. We do that by operating a confidential helpline where our case managers make financial commitments to help with procedure costs and also coordinate logistical support like transportation, accommodations, childcare, and more. We serve residents of Baltimore City, Maryland residents, as well as people who are increasingly forced to travel to Maryland for care. I'm here today to talk about existing barriers that are preventing Baltimore City residents from accessing abortion, provide an update on trends in travel, and raise some strategies for the City Council to consider based on what other cities and states have implemented across the country to maintain abortion access. Just for some context, we connected with about 1,500 people last year who needed support in order to access an abortion. This year, we're on pace to double both the number of calls we're receiving and also the individuals supported. We expect to receive 3,000 calls this year to our helpline, but because of our limited budget, we will only be able to fulfill roughly half of those requests. So that is where our data and our understanding of these client needs and travel trends come from. Just to add some additional context, we do have strong legal protections at the state level for Maryland residents. However, there are still a number of barriers to care that Baltimore City residents may face. That includes the distribution of clinics in Baltimore City and across the state that may make it difficult for someone to travel there, access to transportation, childcare, taking time off from work without pay. All of these factors still make it very difficult for city residents to access care. In terms of travel, we have seen a rising number of people coming to Maryland even before Roe is explicitly overturned. That number has grown by about 7 to 10% each year, and currently, or as of 2021, about half of our clients were traveling from out of state, and the other half were Maryland residents. So far this year, since Roe has been overturned, the majority of travel trends that we've seen have remained regional, traveling from states like Virginia, Pennsylvania, and DC. However, we have seen a notable increase in callers from Texas. At this point last year, we had received no calls from Texas at all. And at this point, we've received or connected with 23 Texans traveling to Maryland to access care. That is very notable. It's not common for us. And that mirrors what we've been hearing from our clinic partners across the state and mirrors greater travel trends kind of across the country as we're expecting this influx. We're not aware of any explicit protections in place to support out-of-care or out-of-state residents traveling for care. That's particularly concerning given the shifting legal landscape and legality of accessing abortion across the country. Fetal heartbeat bills, bounty hunter laws, and aiding and abetting statutes are serious risks to abortion care providers, support organizations like ours, and clients themselves. We hope that Baltimore City will follow the lead of other Maryland officials who have recently announced that they will not comply with non-fugitive extradition requests. We also look to legislation recently passed in Massachusetts, which shields providers and patients from lawsuits and investigations, and has greater privacy protections. We also could put stronger protections in place to protect pregnant people in general from being criminally prosecuted for their pregnancy outcomes, which is not an existing law that we have on the books in Maryland or in Baltimore, I believe. The groups that are most directly harmed by abortion bans, including Black, Indigenous, other people of color, queer and trans folks, people with disabilities, and those with low incomes, are the same groups of Baltimore residents who will find it harder to get an appointment if our healthcare system is overwhelmed by an influx of people traveling here for care. We're excited to partner with the city and the health department to identify and implement strategies to mitigate some of these effects. However, we must have consistent and adequate funding in order to be an effective partner for some of these city agencies. We've been preparing for this moment for a long time. We really just need the resources to be able to do the work. And our fight for reproductive justice is a movement, and it's not a moment. So we are really looking forward and hopeful that grant programs like the one that the city recently made available will continue to support abortion access organizations like ours and our partners to address this ongoing and urgent public health crisis. Thank you.
Thank you, Ms. McCann. For those who are joining us here and are watching home or going to be watching later, I know that I said 3 minutes for testimony. However, I believe that the testimony that we're receiving is useful, that it's helpful. So for anyone else within the public who's here today who needs to testify, we're just going to extend that past the 3 minutes, and I want to make sure that everybody knows that prior to testifying. And actually, Councilman Bullock has a comment or a question.
Yes. Again, thank you for your presentation. One quick question. You'd mentioned that you had seen increases in travel rates pre-Roe. So I'm curious as to what was driving that, if you have any information around that.
Yes, so I think that really speaks to the escalating restrictions on abortion that have been affected across the country and affecting people across the country. Even before Roe was explicitly overturned, states like Texas had put measures in place to try to prevent people from accessing essential health care. Even in Pennsylvania, a variety of restrictions, including a mandatory waiting period, state-directed counseling, and parental consent notification, make it sometimes just easier and simpler for people to travel from Pennsylvania to Maryland for care. Maryland is also home to 2 of only 4 clinics across the country that are able to provide abortion care later in pregnancy. So for very complicated, medical surgeries and procedures, people have no choice but to travel to either Maryland, Colorado, or New Mexico for that type of medical care. And we have 2 clinics, one is in DC and one is in Maryland, so that need for travel had existed for a long time.
No, thank you for that. I think it also underscores what Vice President's been getting at in terms of Baltimore and Maryland being a destination where folks are coming. So thank you for that clarification.
Yeah, absolutely. And we're expecting that it will increase, especially given the uncertain status in states like North Carolina, South Carolina, Indiana, and even DC. I mean, I think people don't necessarily think about DC because it is such a progressive territory, but because of their unique federal status, there is a potential for DC to have restricted access in the future, and that will make Baltimore even more important.
Thank you.
Yeah. Any other questions I can help answer? Thank you.
Okay, thank you, Ms. McCann. And thank you, Councilman Bullock. We're going to be moving to Karen Nelson. And please just state your first and last name and also the organization you're with prior to testifying, please.
Sure. Hi, I'm Karen Nelson, and I am from Planned Parenthood of Maryland. And I really want to thank you all for holding this hearing today, inviting us, and thank council, the whole council and council leadership for it is. I'm sitting there thinking it is so refreshing to have an entire body a governmental body that cares so much about this topic and cares so much about the citizens who require this service. I was asked to come today, talk a little bit about what we were doing to prepare as a clinic located here in the city of Baltimore, and what we were expecting. And I don't want to repeat the things that Lynn just talked about, but I can tell you what we're seeing does mirror exactly what she's talking about. Slow increases, additional phone calls are starting to come in. And basically what we are doing as an abortion provider here is preparing for additional influxes. And how are we doing that? We're preparing to increase our capacity, and we're doing that through telehealth. We're doing that by hiring new providers, training new providers. We've provided a written testimony that details a little bit more of that, but again, we are looking to shore up our medical operations so we can meet current demands as well as any future demands. We do not know, I know everybody's asking, what's the number? What do you expect to see for the surge? And it is all speculative right now. I can tell you that we are meeting regularly with in regions. You asked Dr. DeRaza, are you talking to other health departments? We are definitely talking to other providers in other states, and which includes Planned Parenthood and non-Planned Parenthood abortion providers, to coordinate and to monitor the political situations in each one of these states. I think what you're going to see for a little while is, some of you are familiar with this number, but we've talked about 26 states are at risk since Roe was overturned. There are 15 states right now that have bans. So, and then you're seeing legal challenges. So there's a little bit of back and forth, on again, off again in different states. So we just continue to monitor that and try to see what that means for our additional states. But we are seeing exactly what Lynn is talking about, additional uptick in calls and inquiries. Currently, how are our residents being supported who are seeking services for abortion care here in the city? Well, of course, you just heard from Baltimore Abortion Fund, and we also have other intensive fundraising efforts that are going on. We have a June Coleman Fund that is administered through Planned Parenthood, which provides stopgap abortion patient assistance. So that is available for Baltimore City residents. And then, of course, we've talked about the 2022 Abortion Care Access Act that the state just passed. And that is really going to do, I think you all wanted to hear a little bit about that. What that does is it expands the number of providers that can provide abortion care. It provides equity in health care coverage because it requires private insurance as well as Medicaid to pay for abortion care, and to do it with no copays and do it without waiting periods, like waiting for deductibles. So for us, this was probably the biggest, most important part of the abortion care access, because it provided equity and will provide more coverage for citizens. And then it also provides a training program, a statewide training program, which of course Planned Parenthood providers will be involved with, and of course that will help us to support the care here in the city. We provide gender-affirming care. We serve all residents, regardless of sexual orientation, gender identity, and that includes for abortion care. I will echo what you've already heard, that the barriers that are created when there's barriers in other states, when we have influxes of patients, and any time that there's blockage to receiving health care, those most at risk will be the LGBTQ community, underinsured, and those living in poverty. So we are here. We're here to partner with the health department and partner with the Baltimore Abortion Fund to continue to make sure that everybody receives provision. We were also asked to talk a little bit about what safety measures are in place. As you know, if you go by Howard Street, 330 Howard Street, you know that you will see some protest activity on a regular daily basis. Typically, we have had good relationships with our local law enforcement, and they have been very responsive to helping us when we've needed to make calls. Parking is an issue and will be an issue if we see an influx of patients. You've already kind of hit on that. People are going to have to navigate around the city. And if I could advocate here, a way that this body could help us would be to help us with parking, including like parking, not just parking spaces, but for instance, we have metered spots next to our facility, and oftentimes there are cars parked there for longer periods. It starts to cause a security issue. We just had a big security issue where Mulberry Street had to be shut down because there was a car sitting around for 3 days and it became a suspicious vehicle. Turned out to be nothing, but again, great contact with law enforcement, but I think everybody wants to avoid that kind of stuff. You talked about what the health department can do to support the clinics in Baltimore, and what I would say is, it went up on the screen. It's continuing to partner with us on the preventative health care. If we are providing good preventative care, that means there's a less need for urgent care, and it frees up the time and space for us to do our job when we have good preventative care. The health department has always been a great partner to us. I was sitting there thinking about this. I'm going off script here, but COVID was a perfect example. We got more support from this city than anywhere else in the whole state regarding COVID. I got a phone call in early March. It was like when I was freaking out about how we were going to get masks, and I got a call from the city health department on a Saturday night at 9:30 at night. I've got masks for you. So this is the kind of partnership we need, and we need to continue to have. We work regularly with You Choose, the Teen Pregnancy Prevention Program, and the Baltimore City Health Department. Continuous, Rebecca and Kathy are, we do have those informal conversations about what's going on. So what the biggest thing for us is to continue to be our partner. And if we can do what we can do for other public health care, that just frees up our time and energy to be able to be there for those who are going to seek out abortion care from the city, from the state, and from other places. And again, I would just say thank you for allowing us to comment today, and we're here to be a partner as well. I'm happy to take any questions.
I want to say thank you for your testimony. It is greatly appreciated. And I always like to hear, sometimes we hear about what the city is not doing. Mm-hmm. So thank you for uplifting what our health department, what that collaboration looks like across just different areas. I think that it just needed to be said. Mm-hmm. Thank you. I'm going to allow, we don't have any hands up or anyone within the WebEx. Actually, we do. Looks like we have one person. Jenny Mystery. And Ms. Mystery, before you provide your testimony, please just provide your first and last name again, and also the organization you're with, if you are with an organization.
Can you hear me okay?
Yes, we can.
Great. So my name is Jenny Dotson Mystery, and I am the Vice President of Programs and Partnerships at the National Institute for Reproductive Health. And I want to thank you for the opportunity to testify today in this hearing. The National Institute for Reproductive Health is an organization that works on the state and local levels to advance reproductive health rights and justice. And in my role there, I've worked on municipal policy to support abortion access for more than a decade. As part of that work, I'm one of the authors of NIRH's Local Reproductive Freedom Index, which is a report issued every 2 years that evaluates cities and counties on 34 unique policy indicators related to reproductive freedom. Baltimore City is included in this report, and I'm pleased to report that the city received a score of 3 out of 5 stars in the most recent edition, which looked at policies through December 31st, 2020. Our research found that Baltimore has taken many steps in several of the categories that we look at in the report, including funding and coverage for reproductive health, supporting young people, supporting families, and building healthy and just communities. I think that's reflected in a lot of the testimony we heard today from the health department. Though I do want to underscore that I'm sure that there's much more work to be done in these areas. But given the focus of today's hearing to establish Baltimore City as an abortion rights protection jurisdiction, I report that Baltimore did not receive any points in the local indexes section on protecting abortion access. The policies included in this section are clinic safety protection measures, regulations on the deceptive practices of anti-abortion pregnancy centers, also known as crisis pregnancy centers, local protections for abortion clinics and providers, public awareness about access to abortion care, and anti-discrimination ordinances based on reproductive health decisions in employment and housing. Baltimore City also did not receive points for funding abortion. I do want to say again that this only looked at policies through December 31st, 2020. My understanding is that, really excitingly, there has been funding allocated for abortion this year, so that would change for the next iteration of the report. In the wake of the devastating Supreme Court decision in Dobbs v. Jackson Women's Health Organization and the rapid succession of states taking action to ban or seriously restrict abortion, it is more important than ever for states where abortion will remain legal and accessible to shore up abortion access for their own residents and for all those who will travel there for care. As we've been discussing, Maryland and Baltimore City are crucial access points, and in particular will be for the South. I'm so pleased to be part of this hearing today and to hear that the Baltimore City Council and the Department of Health are taking seriously your responsibilities to be an abortion rights protection jurisdiction. The local index provides an important entry point into developing new city policies, but the strongest recommendation I could have made is for the city to build strong relationships with local advocates and abortion providers who are already doing the work to expand access to abortion in Baltimore City for years. So I'm thrilled that Planned Parenthood and Baltimore Abortion Fund preceded me and shared some great information and recommendations about the needs that they see and the successes that they've seen as well. This kind of partnership ensures that the responses that the city develops are informed by community needs and experts in Baltimore City policy. That being said, as a national expert and an organization that works on local policy across the country, I am happy to provide whatever support I can in order to move this work forward and to support effective policymaking. Reaffirming the city's commitment to the right to abortion is important and to be celebrated, and then the next steps that the City Council must take will be to actively protect and expand abortion access, which can take many forms, again, as discussed already. One other important local initiative that I wanted to highlight is an effort to establish a reproductive justice task force in Baltimore City led by Reproductive Justice Inside. I strongly encourage the city to consider this as a way to support the development of the abortion rights protection jurisdiction. The task force could provide the city with regular opportunities to hear from community members and experts who can provide feedback, support good reproductive rights policy, and help with implementation. Thank you so much for taking up this important issue, and I look forward to seeing what you all do and to offering any support that is needed that I can.
Thank you for your testimony, Ms. Mystery. If there are any other attendees who would like to provide testimony at this time, please utilize the raise hand function. And at this time, I do not see additional public testimony via WebEx. I am going to go to Madam Vice President Middleton for final comments at this time.
Thank you, Madam Chair. I just want to first thank you, Dr. Dirazi, again for taking time out of your schedule to really give us a update, and all of the partners. And this hearing just reassured us that there are plans working. This task force is important and a great opportunity. And as the Baltimore Abortion Fund representative mentioned, you know, this is a continued movement. We are this is a public health crisis, and I'm glad to see that we are, your agency and all the partners are taking this seriously, and just wanted to let you know that the council is taking this seriously as well. And we want to keep, we want to stay in contact and just keep giving us regular updates. It's a way that we can, if there's, you know, it's showing and giving us information on ways we can continue to help and keep servicing people that are in need for help with this particular subject. So again, I can't thank you all enough. Thank you, Madam Chair.
Thank you, and thanks to everyone for joining today. The committee is going to schedule a follow-up meeting in the future to get additional information and continue this important discussion. This hearing is now in recess. Everyone have a great day.